I'm Dr. Andrea Behr, and I work at SSM at a hospital called St. Joseph Hospital in Lake St. Louis, and I am a breast surgeon there. I think that there is always a lot of anxiety around feeling a lump in your breast or having an abnormal mammogram, but getting in for that exam with a breast surgeon or getting that biopsy scheduled, the majority of the time will turn out not to be breast cancer. So getting that answer rather than sort of delaying things or hiding can really calm your fears and let you just go back to your normal life knowing that you're okay. It's certainly extremely stressful and very scary. And my priority is to get the patients into my office as soon as possible, because once you're able to sit down and talk about where you stand with your diagnosis, what stage you are, and what your options are, which more and more are becoming vaster options that patients have to choose from so that they're more comfortable. I think a lot of that anxiety can be calmed after that first visit with your doctor. Well, historically, we only had one option to offer, which was mastectomy, and that did not include reconstruction. And so now we have many options for patients, which still does include the mastectomy, but now includes the option of offering reconstruction with a plastic surgeon. And then we also have the option of breast conservation or lumpectomy. And it's important for people to understand, and a big portion of what we do talk about when we're going over surgical options is that the survival outcomes are the same for breast conservation as for mastectomy. So women can keep their breast and know that they're being treated just as appropriately as if they were to do a mastectomy or a double mastectomy. The oncologic treatment is the priority. We need to get the cancer out and be safe. But now we can do that with different localizing devices through a hidden scar, oftentimes, which means that you don't have a scar right over your tumor, wherever that may be, but we can hide the scar under the breast or around the areola or even up in the armpit. So you virtually can't tell that you had surgery after a hidden scar lumpectomy, which is really nice to not have that reminder that you had to have that breast cancer surgery when you're cancer free and just living your normal life. The priority is to shorten the amount of time that they have to be there and really to just get it done in the morning and get them home to the comfort of their own home. So we used to have patients arrive multiple hours before their surgery in order to have devices placed so that we can find the tumor in the operating room, as well as injections that allow us to identify the correct lymph nodes to remove. And now with devices like MagSeed and MagTrace, we eliminate that need for that early arrival. So we can have a patient show up to the hospital and an hour later they're in the operating room, and then an hour following their operation, they're on their way home. We increased our already robust cleaning techniques and sterilization process, and made things a lot safer in the operating room as well, because in a time like this, we have to keep our breast cancer patients safe and we have to get them through treatment just as we would have during the pre-COVID era. I think we all recognize that the only way to catch up on all of the time that we lost is to extend hours. So in particular, our breast center has extended its hours so that we can safely space out the patients and catch up on those patients that did not get scheduled when they were supposed to be over the last couple of months. And in the surgery office, we make the space, we find the room, we get patients in so that we can get them treated just as we would have before the COVID era. That's a really interesting question, and it won't depend only on the hours that we make ourselves available, but it will depend on the comfort of patients in coming in to get mammograms, because the majority of our breast cancer is detected through screening mammograms. So we want people to feel safe. We want them to get screened. We don't want them to fear that they will get COVID by coming in for a mammogram. But in all honesty, it's safer to come in for a mammogram than it is to be going to the grocery store.